Good evening, everyone, and thank you for joining us tonight. Before we get started, as always, I would like to read this brief disclaimer that you see on your screen. And it is this: the PharmAssist virtual learning experience, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And now that we have that out of the way, I would like to say thank you again for joining us tonight. My name is Craig Orapello, and I will be your host tonight for the PharmAssist Virtual Learning Experience, which is an educational program created by Mandel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your very own home. The PharmAssist program takes place every Monday night at 7 p.m. Eastern Standard Time. And tonight we'll be providing a live medication instructional program on 3 common fertility products, including an interactive Q&A throughout the program. And that is where you come in. You can join us via Zoom or Facebook Live, and we invite you to be a part of the discussion by sharing your questions in either format, whether in the chat or directly into the Q&A section on Zoom. As always, we are joined by various amazing HCPs each week from across the nation to provide you with a real-world experience, just as if you were sitting across the table from them in their clinic. And today, we are joined by Kaitlyn Endicott. So thank you again for your time and interest this evening. We're so glad that you made time to be with us tonight. And I now want to turn it over to Kaitlyn. Take it away, Kaitlyn.
Thank you very much, Craig. Hello, everyone. Thank you so much for joining us tonight. Like Craig said, my name is Kaitlyn. I'm an IVF nurse in the Northern Virginia area. I hope that tonight's videos and instructions will help you to understand and gain some confidence with your injections and administrating them. Tonight, we will be discussing 3 different medications. We'll start out with the Gonol-F multi-dose vial. Then we'll go into the Gonol-F RediJect pen, and then we will finish out the evening with the Centerra Patch. Like Craig said, after each video, we will have time for Q&A, so you can type in any questions that come to mind while you're watching the videos. Be sure to put those in, and we can tackle them as we go. Please do keep in mind that I am happy to answer any general questions about the products, but I cannot answer any specifics to your protocol, such as why you're on a certain dose of medication or something like that. But please feel free to ask any questions and I'll answer them as I can. Also remember too that these videos will be available to you in many different ways. So you don't have to jot down everything I'm saying. All of the pre-recorded videos and tonight's broadcast will be on either the YouTube page, Facebook page, or you can go to mymandelspharmacy.com/PharmAssist so you can see them anytime there. I think that is it for introduction, and we're ready to get started. Like I said, we will be starting with the Gonol-F multi-dose vial. So we are ready for that when you are, Craig. Instructions for the Gonol-F multi-use vial. First, collect all of your supplies. So you will need your vial of medication. You will also need the pre-filled syringe that's full of saline or water. And you will also need one of the provided syringes. The medication will have a cap on it. It'll just pop off like this. You'll see the rubber stopper there. At this point, you can take your cap off of the pre-filled syringe. I recommend getting into the habit of taking an alcohol prep wipe to wipe off the rubber top of the vial. In order to compound the medication, you will just push your needle into the vial of medicine, inject all of the water into the vial. Once all of the water is in the vial, you can take out the syringe. It can go into your sharps container. And at this point, you have your medication reconstituted. Now you'll use this vial multiple times. So at this point, you can go ahead, take your syringe, Peel it open. It peels open like a banana peel. And then at this point, I recommend pulling back on the plunger until you meet the dose that you're prescribed to by your provider. So for the sake of this video, we will use 150 units. So I pulled back 150 units of air and take off the cap, insert it into the rubber stopper, inject your air in, flip it over, and pull back to 150. If you get a little bit of air in the syringe, that's okay. You can push it back up and restart. So go back until you see 150. You can see I have it here. And then take out your needle. Now we want to go ahead and prep the site for injection. This is a subcutaneous injection, so pinching an inch of belly fat or pinching an inch of skin on the thigh are both appropriate areas for this injection. So once you've chosen your site, you will take an alcohol prep pad, clean the site off, let it dry, and then you will pinch that inch of skin and go in fast at 90 degrees like a dart. And then push the plunger, hold it for a few seconds, then take the needle out. You can get rid of the needle into your red sharps container, and you've completed the injection. Okay, so that was the Gonol-F multi-dose vial. That vial, you will get multiple injections out of it, depending on what your dose is. So make sure that you hang on to it and you don't discard it or throw it away before all of the medication is actually out of the vial. You'll just keep drawing up from the same vial until it's completely empty. With that, do we have any questions rolling in quite yet, Craig?
Hey, how's it going, Kaitlyn? All right, perfect. So just a couple quick things to get out of the way again. If you have any questions at all, reminder, just you can type them directly into the chat if you are in Facebook. And if you're on Zoom, you can write it either in the chat or into the Q&A. Either will suffice, and we will get a hold of those. So first question coming in is, what happens if I miss my shot of Gonol-F? Should I be worried?
Great question. So we're human. Things happen, we make mistakes, we forget, but this is definitely one that I would run by your provider, see what their preference is in the event that this happens. That way you are prepared. If it happens, you'll know what they prefer you do. Depending on when you notice that you missed the dose, maybe they will want you to go ahead and take it at that time. Depending on how much time's passed, they may not want you to take it at all, and they'll just note that that wasn't, taken at that time or that day at all. They may want you to compensate, change your dose around. So that's definitely something that I would discuss with your clinic, and just you can even ask them before it happens. That way you're not in a panic. If this were to happen, what's your protocol for that? What do you want me to do? Most clinics have an on-call line that you can call and, in a case of something like that to get guidance as to what to do. Sorry, I couldn't be more help on that one, but that's one you definitely want to run by your provider. There's many different ways that they can tackle that one.
Definitely perfect. And that's another good point. As you mentioned before, we are trying to stick to questions that are things that that are a little bit more general. And so anytime we do go down a path where it might be something that we definitely want you to reach out to your specific clinic, we will try to direct you in that case. So that's part of the program here, is to make sure that you'll be a pro by the time you're ready for that shot. And we can get out all the little questions that you might have of how do you do something, or what happens if this happens, or what do I do about that? All those things that we can get rid of now, we will do that. So by the time that first shot is about to be taken, you'll already be a pro. So great. Thank you so much, Kaitlyn, there. And so another question that came in that said, so how long will I typically be on my Gonol-F throughout my treatment cycle?
Good question. So typically in a cycle, this is one of the first medications you're going to start out with. And you typically, continue it until you're planning the egg retrievals. So it's pretty much for the duration of your cycle. Typically, a cycle will last anywhere from 9 to 11 days on this medication. However, could be a little bit more, a little bit less. It just depends how your body responds to the medication. So throughout the cycle, your clinic's probably bringing you in for blood work and ultrasound appointments along the way, taking a look at progress and timing out specifically when that egg retrieval procedure will be. So like I said, 9 to 11 days, give or take on average, but ultimately it's going to be one of those things where we're just watching your body closely to determine, when that last dose needs to be given, when that egg retrieval can be planned. Great question.
Perfect. Thank you so much. And I know these are some of the things that people get a little bit nervous about. You want to ask these questions now so that you're not worried about later on making a mistake or not knowing. And in this case, being, prepared is always going to be more valuable if you know up front what the purpose of or the duration of a medication might be. So that's an excellent question, and we appreciate those. So feel free to keep them coming in. Just like this question. So this comes up almost every single time. I know you've answered this many times, Kaitlyn, on the program before. How does the overfill work to save money when dealing with the multi-dose vial specifically?
Yes, this is a popular one and definitely an important one. So the overfill on these meds, the Gonol-F multi-use vials come in two different quantities. One is 450 units. The other is 1,050 units. The overfill is 150 units in both of those, no matter, what volume you're getting of medication. So if you break it down, it's really more bang for your buck to go with the 450 unit vial because you're getting that additional 150. So you're getting 600 out of that. Now, work with your nurse or your provider, whoever's ordering your medications, to determine what's best for you and how much they would typically order based on your dose. But definitely keep in mind that the 450 is going to be more bang for your buck if you get multiple of those vials compared to getting just one 1,050 vial. You're going to get an extra at least 300 units in overfill from two of the 450s. So a little bit of number crunching there, but however many units they recommend you buy, if you divide that down, by 450, and then you can take into account the 150 overfill, you can definitely cut back on the amount of medications that you need to order.
Awesome. Thank you. I know one of the biggest things probably next to how to give an actual injection is probably about the finances around it. So that's an awesome answer. And I know that's something that people will always want to know. And that's a big part of what we're here for, both with the PharmAssist program as well as Mandel's in general, is that we're here to answer a lot of these financial questions for you and really help you feel comfortable knowing that you're getting, the best possible deal that you can, and also understanding what your financial options are. And that's really part of where this all came about, is because sometimes we don't think of those questions when we're sitting in the clinic. Sometimes it comes to us after the fact, and that's part of what this is, to allow you to have those, those epiphanies that we all have the moment we walk out of the clinic. Well, now you don't have to run back in and ask. You can just wait and ask at the PharmAssist program. So speaking of running back in, if you have questions, we are all caught up with questions right now. But as always, this is not like if once we move on, you don't get a chance to ask your question. We ignore all the questions from the first part, right? You can ask questions throughout the entire program. So we will definitely be allowed after the second and third question if you have any questions about the multi-dose vial. But in the meantime, let's give everyone about another 30 seconds if they're trying furiously to type their question in to get it to you on time. Kaitlyn, I'll throw it back to you, and then we'll check to see if any more questions have come in.
Great. So like I said, this is one of the first medications typically that you'll start out with during an IVF cycle, and it's pretty well tolerated. One of the better ones to begin with, just because, like I said, it's a subcutaneous injection, meaning it's a smaller, no longer than like a 1/2-inch needle, goes right under the skin into that subcutaneous tissue and the fatty tissue. So usually, like I said, pretty well tolerated. Patients tell me that they'll feel that initial prick or nothing at all. I'll tell you, I've done it myself, so I can attest to that. I agree that, the actual medication going in typically doesn't cause much discomfort, if at all. It's just the needle. I felt it a little bit, I'll admit, but definitely not as bad as I thought it would be. So hopefully that makes you feel good about the Gonol-F. Any other questions rolling in, Craig?
I love that you're able to give firsthand your own personal experience with it as well, which is great. And I think that's something that really has a very big impact for people when you're trying to ask these questions, to know that somebody's been there or has heard about it, has gone through it themselves. So great. Anytime you can share that would be amazing. We appreciate it. But with that being said, we are all caught up with questions right now. So we are ready to move on to the next product. But again, if you have any questions or you think of something after the fact, feel free. We will definitely get to it. Your choice, your chance has not been missed. So we're ready to move on whenever you are.
Great. So next up, we have the Gonol-F pen. So the Gonol-F medication can be dispensed in two different forms, one being that multi-dose vial we just went over, and then the second option is the pre-filled pen. So next up, we'll review that. We can compare differences and similarities there, and those are questions I get a lot. So we'll cover those when it's all said and done, and you can decide for yourself which one you prefer. So we are ready when you are, Craig. In order to inject the Gonol-F ReadyJect pen, you need a couple of supplies. First supply is, of course, your pen. Second supply is your needle cap. Your box should come with a bunch of these little guys in there. Third thing you'll need is your alcohol swab to prep the skin site. The first thing I have patients do is, of course, take off the cap to your Gonol-F pen. You'll see there is a chamber. This is where the medication is held inside of the pen. There are different units of pens, so depending on the size unit that your provider ordered, there will be different amounts in the pens. So always confirm that there's the correct amount in the pen. Then take the needle cap. This paper will peel off like this, and you'll see the needle inside. Be careful not to prick your finger there. And then the cap just twists on to the top of the pen. At this point, I have patients dial up their dose. So you'll see that there is a window there. You can see 0 in there now. Depending on what your dose is, that is the dose you will dial up to. So for the sake of the video, we'll dial up to 150. So you'll dial it back until you see 150 units in the window. Now, if you go too far, that's okay. Go back and forth. It's not going to hurt anything here. So go until you see 150. So at this point, I recommend prepping the skin site. Now, this is a subcutaneous injection, which means it's just going to go into the fatty tissue. There's different sites that you can use. Your provider might have a preference. In general, typically, I recommend the abdomen. So anywhere that you can pinch an inch of skin and the belly fat is fair game, as well as the thigh tissue as well. For the sake of the video, this is going to be my skin for today. So at this point, you'll take your alcohol swab. Go ahead and clean off the site. Let it dry. Let it sit for 15, 30 seconds until it's completely dry. That helps take away any discomfort when injecting with the needle. Then you will take this big cap off, and you'll see a colored sheath here left over. Now, this is your last line of defense before the needle, so make sure that everything's ready. Once you have confirmed that you're ready to inject, you'll take this off here, and you'll see the needle. At that point, you'll pinch an inch of your skin that you've already prepped. And then I recommend, I tell my patients to have the window with the numbers facing up toward you so you can actually see it when you're injecting. And then you'll go in fast, 90 degrees like a dart. Yes. Wiggle your hand up and you'll push that plunger. Push it hard, and as you're pushing the plunger, you'll actually see the window go down to 0. That's how you know you got your full dose. At that point, you can take it out. And then I recommend recapping with the big cap so that you don't stick yourself. That just pushes on there. And then it turns off the opposite way. This part goes into your sharps container. Your Gonol-F pen, you can put the lid back on. They are multi-use, so be sure to save it for your next dose. You don't want to toss it out until the pen's completely empty. Okay, so that was the Gonol-F pen. Now, Keep in mind with the multi-dose vials and the pen, it's the same medication. It is just distributed differently. So there's no pro or con, in terms of how the medication works, if one works better than the other. It's the same medication. It's just a preference of having it pre-filled in a pen or having to reconstitute the liquid into the powder and then drawing up from the vials. So typically, if your provider or your office doesn't have a strong preference of one way or the other, then you can decide that for yourself. I've had some patients do a pen one cycle and then a multi-use vial another and mix it up. That's totally fine. Like I said, it's the same medication. So as long as your office does not have a strong preference for one mode over the other, typically then you can decide, as a patient, which one you prefer to be administering. With that, do we have any questions rolling in quite yet?
Yes, we do. So this one comes in. I'm not actually entirely sure if this was the first question for this product or the last question for last product, because there is some overlap. But the question here is just a very basic overview of Gonol-F and FSH in general. And it says, what is the purpose of FSH as part of my treatment cycle?
Yes. So not only do we want to know how do we administer these medications, but what are these doing to me, right? So excellent question. So FSH stands for follicle stimulating hormone. So this medication is quite literally stimulating follicle growth. So within a cycle, we are looking at the ovaries. Within the ovaries, you have follicles. Within the follicles, you have eggs. So the goal of an IVF cycle is to retrieve all the eggs that we can get. So we are actually, giving your body additional FSH or follicle stimulating hormone to grow out those follicles. And we want to grow out multiple follicles. We want to get as many as we can. So more than just what your brain does in a normal menstrual cycle. The goal of a normal menstrual cycle is to get one mature follicle to ovulate an egg. That's the goal. Now with IVF, it would take us many menstrual cycles if we just followed it and took the mature egg from every cycle. This way, we're actually maximizing our egg yield by giving additional follicle stimulating hormone to trick the brain into thinking and the ovaries that we need the most follicles it's going to give us that month, whatever that means for you based on your ovarian reserve. So that is what the Gonol-F is doing. It is actually making these follicles grow and those eggs within the follicles mature. So very good question.
Perfect. Thank you so much. So now, I guess sticking a little bit into more of kind of the general utilization of either the vial or the pen, but as we're talking a little bit more about we covered how it works, and now let's talk about the things that we necessarily don't like as much as the side effects. And so, question comes in that says, what are the most common side effects with utilization of FSH in general? Anything I should know about them?
Very good question. Typically, I will say these are pretty well tolerated, all things considered. The most common side effects I hear about are some irritability and fatigue, as well as bloating. So when you think about what the medication's doing, right, it's pumping up those follicles within the ovaries. We're getting larger. It can cause that bloating to occur and kind of be uncomfortable. Especially in the back half of your cycle. So earlier I said, typically you're on these medications anywhere from 9 to 11 days, give or take. So when you're around day 6, 7, 8, 9, and forward, you're starting to feel very full. I have a lot of patients tell me, I think I can feel my ovaries in there, which is not something that we typically feel in a normal month because they're within normal size. They're producing one follicle. This, we are actually increasing the volume of that ovary for the month. So it can cause some bloating, some uncomfortability there, and some fatigue, just tired, and kind of feeling run down would be the other big one that I hear. Typically, though, these side effects are going to subside within a day or a couple of days after your egg retrieval. So throughout the cycle, all of your hormones are kind of increasing your estrogen level and everything. And then after the egg retrieval, things drop off And from there, your body normalizes. So usually within a day or two, maybe a couple after, depending on your levels, those types of side effects will subside. Very good question.
Perfect. Thank you so much. I think, we are now gotten through a couple of questions here that are about FSH a little bit more in general. And this is a little bit more specific to the pen side of things. And so the question is, how do you recommend that I handle leftover Gonol-F in a pen if my cycle is complete?
Yes, very good question. Like we said earlier, these medications hold, a lot of financial weight. So I have a lot of patients ask me what to do with leftover medication. I always tell them, go ahead and hang on to your medications until they expire, just in case there's a chance that you need to undergo another IVF cycle, then there's potential for you to use them. Now, with the pen, keep in mind there's a few key things to remember in terms of expiration for this pen. When you get the Gonol-F pen, it's going to be packed in a cool pack that's keeping it cooled down. The recommendation is to store it in a cool place, so in the refrigerator, not the freezer. As long as it is unopened and stored in the refrigerator, then it is good until the expiration date that is on the box. Okay, so from there, though, say you accidentally left it out and it sat at room temperature and it's completely reached room temperature, that's totally fine. It's good for 3 months from that point, okay, if it has not been used and if it's unopened, you then have 3 months. Now, in the scenario for this particular question of leftover medication, what to do with it, it depends where you're at in this time-sensitive window of expiration. So if you have opened a pen and used it, so you've injected your first dose, whether that pen is cold at that point from the refrigerator or if it's at room temperature, you have 28 days until it's expired. Okay, so I usually tell my patients at that point, go ahead and mark on your pen with a Sharpie, permanent marker, either the day that you used it first or the 28-day mark, later that it's going to expire. So depending on where you are, if you have to do another IVF cycle and it's been within 28 days of the first use of that pen, that's all fair game. That's good stuff. You should use that. Now, if it's been more than 28 days from first use, it's expired. So at that point, I would go ahead and discard it in your Sharps container. That's the appropriate way to get rid of that old medication. A lot of dates and days and numbers there. So like I said, this video will be posted on the PharmAssist page, YouTube and Facebook. So that's when you can go back and relook at. Don't worry about jotting all that down. Great question.
Perfect point. You took the words right out of my mouth. It's great to be able to have these things on demand, not just live. So you can kind of let it wash over you the first time and then go back and sit down and sometimes people watch it literally, moments before they're about to give a shot for questions on technique. Other times you might watch it the day or so before when you're, for purposes of things that you just talked about there, or you just want to have an idea of like, oh, I forgot, what do I need to know? So great. Thanks for pointing that out. Mm-hmm. So another way that the PharmAssist program can definitely help out. So let's see. Next question coming in here says, okay, so earlier somebody had asked the question about what happens if they miss the shot of Gonol-F altogether. Mm-hmm. This one's slightly different, but also equally as important. And this question came in actually a couple different ways, but basically says, what if I make a mistake and dial up and or dose too much of my Gonol-F? What should I do? Should I be worried?
Yes, good question. So a couple scenarios here. Like in the video, if you dial up more than your prescribed dose, but you haven't injected yet, okay, so you dialed it up and you went past your dose, you were about to inject and you caught it. Oh, that's not my number, right? You can just dial back. It's not going to hurt anything on the pen. Just back and forth until you get your dose in your window. Now, if you realize that you injected the wrong dose, specifically if you did too much, then I would definitely notify your clinic, let them know what time you did it at, how much you did it at. And they may have you compensate for that if you're on another medication in your cycle that you're doing that day, or they may just note it and have you continue on. So they may make adjustments. Either way, you definitely want to make them aware. That way, when they're reviewing your cycle and the outcomes and that sort of thing, they can note, any instances that the dose has changed or anything like that. So definitely make them aware. There's different ways to compensate, but that's going to be something that your clinic will have a preference on. Great question.
Perfect. Thank you. I mean, obviously not something that people want to intentionally have happen, right? You want to make sure that you are aware of what and when you should be giving your dose and of how much. But it's always great to know that, yes, sometimes mistakes may happen and you want to be aware at least that there's options on the table. So again, always try not to make the mistake, but know that if the mistake happens, you can always reach out to your clinic and find out. And you're not the first person that has had these situations before. So they're well versed in how to respond and have ideas on how to help. So thank you so much, Kaitlyn. I think those are the things that really people get probably the most nervous about, are if it's not like, is this going to hurt? Probably the second biggest thing is, what if I make a mistake? And, and this is really helpful to have this as that moment to get all of your what ifs out here so that you don't have them happen when you're about to give the actual shot, and you'll feel a lot better about yourself. So great. With that being said, right now we are all caught up with the questions. So as always, we'll give another 30 seconds or so for people if they're trying to get those questions in before the bell, before we move on to the next product. But always remember, we have one more product, so we will have time at the end to answer questions about all three. But I will throw it back over to you, Kaitlyn, just as we give people that time to get that last question in. Great.
Another scenario, just kind of feeding off that last question. So what if you don't do enough, right? You noticed afterwards you didn't actually dial up enough of your dose. Well, you just bought yourself a second injection, most likely. I don't think that many clinics are going to say, oh, that's okay. So you're going to have to do a little bit of math, but you're just going to do the same exact thing. Put on your needle, dial up the difference of the dose that you missed, and just do another injection to make up for that full dose. Your body doesn't know if you did, 2 separate injections, 5-10 minutes apart. It just knows that it's getting that dose of medication. So just another thing to remember too. But triple check that window on the pen, and then you'll know you're getting your right dose. Do we have any other questions rolling in yet, Craig?
I think as of right now, we are all caught up. So I will turn it back over to you to get ready to move on to the next product. And of course, as we always say, get those questions in there. We will, if you have questions about the Gonol-F as we move on to the next product, we will certainly answer them for you. But other than that, we're ready to move on.
All right, great. So our last product for tonight is the Centerra Patch. Although this is an optional medication, it is one that I have a lot of patients utilize, and they are always grateful for it. So I'm very excited to be able to cover this one tonight. I think that this helps to take out some of the anxiety and anticipation of the injections and make it a little bit easier. So with no further ado, I think we are ready. Now we will review how to use a Centerra patch. The patches will likely come in packages such as this. So I recommend just gathering your supply there and deciding what site you want to use. Now, the patch does need to be applied directly to the site that you plan on doing an injection, and it does need to be applied about 20 to 30 minutes prior to your planned injection. You'll take your patch out of the packaging. This is the top of the patch, so when it's on, this will face outside, and then the sticky part is here, and there is a plastic film over it that you'll need to peel off. So it comes apart like this. And this does need to be applied to skin that is unopened and clean. So if you have residual tenderness or scabs, I wouldn't recommend putting this over that skin. I would find a fresh new site. And then after that, you just apply the patch to the skin Make sure it's flush against the skin. You do want to make sure to not cover up this outside part where it has these little vented holes. That's how the patch begins to do its magic. So when it's on, it'll actually feel kind of warm, and that means it's just increasing that blood flow in order to kind of absorb the medication even quicker. Once you have it on for 20 to 30 minutes, you can peel the patch off and then prep the site for your injection. And that's how you use the Centerra Patch. Okay, so that one truly is as easy as it looks. So that's one plus with this one, and it also kind of takes the edge off of some of these injections. One thing I forgot to note in the video, when you have taken the patch off of the skin and it's done, it's only a one-time use, it's recommended to take your empty bag that it came in and just press the patch on there for disposal, because in here you have the medication. So it keeps that from potentially encountering anyone else. So just adhering that patch to the empty plastic and then getting rid of it that way is the recommended way to dispose of this one. So with that, if anyone has any questions on this nice little option that, like I said, so many of my patients enjoy this one. It really just helps to kind of take the edge off with the injections. But I am ready for those whenever you are, Craig.
You got it. All right. So this one came in talking a little bit about how the patch works, right? Like you mentioned, how it does its magic, right? And so people just want to make sure they know they're doing it correctly. And so I know you said that it's going to feel a little bit warm when it starts to actually increase the blood flow. But how do I know if I don't feel that? How do I know that the Centerra Patch is actually working? Is there something I should be looking for to know that I've had it on long enough?
Yeah. So like I said, the heat is one key indicator. You also want to make sure that the patch is open to air. So you don't want to, put the patch on and then put on like a tight shirt over it. The best way to do it is have it completely open to air. There's actually holes on top that help the air filter in to activate the patch. So if you're not feeling that heat, or you don't feel like maybe the patch is working to its potential, it could be because it's not exposed to air while it's on for that 20 to 30 minutes. So I would definitely, say you did it one day and you weren't sure if it totally worked. I would definitely leave it completely open to air, leave it on for 30 minutes, and I'm sure that it will have taken effect with that.
Perfect. Thank you so much with that. I think this is one of those ones where people aren't always entirely sure how this works. So some questions come in around that, but also because it has the, assist with pain. There's always, this question comes in almost every single time. I know you've answered it a million times. We've had this on probably almost every single PharmAssist where we've talked about this product. And it comes in saying, is it possible to accidentally overdose with the Centerra Patch? Is it dangerous?
Yes, this is a very popular question. So first and foremost, you really, really only need to keep it on for the 20 to 30 minutes, okay? But if you forget about it and, it's on for longer, I've spoken with people from the manufacturer, and they've ran tests where someone had multiple patches on their body, and they've done all those things. It's very unlikely that you're going to have a true overdose or a major reaction, or be in serious danger with that. Now, like I said, you really only need it for 20 to 30 minutes. You don't need to go over that. So good rule of thumb, once you put on the patch, set a timer on your phone or whatever for 20 to 30 minutes from there. It reminds you to take it off. You take it off, you're ready to go. But yes, very popular question that I get about this one.
Yeah, definitely. And you mentioned using your phone. I mean, we all have, whether it's your phone or you have some type of a smart device, your Alexa or your Google or whatever. And I apologize if I just set everybody's off at home, but you use all that technology to your advantage, and just, set a timer and have it just ping and let you know. But one thing, and this is just only because this question has come up and I did look it up, that actually the exact specifics of how safe you can be with this is they did 2 to 4 patches at the same time and left it on for as much as 60 minutes. So, much longer, and it's still only hit basically roughly, without getting into the weeds on it, it roughly hit like, percentage points of what the risk factors would have to be. So, this is a very safe product, to your point, Kaitlyn, and it's made that way for a purpose. So it's great to know that it's there to help you, and that you also don't have to, you're not like sitting at the clock like, got to get it off immediately or anything like that. You're more than safe. So thank you so much, Kaitlyn. Appreciate that. And then this last one that comes in says, will using the Centerra Patch in combination with ice provide a benefit to preventing or treating that injection site pain, considering one's cold, one's hot?
Yes, good question. So I would say that if you're intending to use the Centerra Patch, just stay away from the ice. You don't need it. This patch is actually going to be working at a deeper level with numbing within the layers of the skin than the ice probably will. So if you have the choice between the two, definitely choose the patch over the ice. And like I said, with the heating mechanism of the patch, you want to be able to feel that. And with the ice, I don't know if there would be any, if it would decrease that effect, I don't know. But like I said, the Centerra is going to work much better than ice. Save yourself that skin freeze of holding the ice to your skin, and just go with the patch. It's going to do the job. Very good question.
Perfect. Save your ice for what it was intended for some type of a drink, whatever. Okay. That's fine. And use the Centerra for what you had it written for. Great. And actually, so this question just came in tying up to that, just popped in saying, so how long exactly does the numbness last? Or is there like a specific amount of time that you should be, prepared for that to last before you'll start to get feeling back in that, in the site?
Yeah, that's a great question. I'm really not sure the specifics of how long this one is going to last. Really, my questions usually come from, how long before a certain injection should I leave it on? I would say probably within an hour or two, you're going to get full feeling back. But I'm not too sure on the exact timing. That's a good one. I'll have to look into that one.
And one of the great things too, I mean, any of these types of questions that come in where we don't have an exact answer, we always try to give to the best of our, knowledge. So like, again, this is exactly what it'd be like in the clinic, where we share the answers that we have on hand. But one of the things we can do is we can try to find out if there is an exact number, because there may not be, right? There may not be an exact, it's going to be a rough amount of time, just like, you go to the dentist and they don't say it'll be back in, numbness goes away within exactly 45 minutes later. It's kind of a rough estimate, but we can look into that and definitely get that posted up on the Facebook page alongside where this will be posted, so that you can hop back on and get an answer there as well. So just wanted to let people know it's a great place for the interactive nature of PharmAssist to come into play, where we can answer questions sometimes after the fact and come back and provide you with a little bit more information. But thank you so much, Kaitlyn, for giving your best estimate on all of those different questions, because Centerra is a little bit different than everything else in the way that it works, and the way that it, in the way that it works within the body, and the way the utilization of it. So thanks for taking a crack at all that stuff. So it does seem like, as of right now, we are all caught up with the questions. Oh, and we got a great sounds good anyway. So I think we're probably good with that answer. You gave more than enough information. So thank you very much, Kaitlyn. So it seems like we're all caught up with the questions right now. Again, we will give people, another, if you have a question that you just thought of about Gonol-F based on, some of the questions that we just talked about on Centerra, or vice versa, anything that pops in your head, we'll give another 30 seconds or so for people to get those out there. But in the meantime, we can probably start to wrap up and get ready to close out for tonight. So I'll throw it back over to you, Kaitlyn.
Sounds good. One small note too that I thought of with the previous ice question. A lot of patients use the Centerra Patch for progesterone and oil injections. Just as a blanket statement with those types of the oil injections, I always say stay away from ice with those. You definitely want to lean more toward something like a Centerra Patch if you're looking for something to help with numbing. And the reason being is with the ice, you're actually making the skin and tissue cold, which will make the actual oil within the injection, once it's in the body cold. So it'll be harder for that to disperse. It'll be more uncomfortable. So just a small little nugget of knowledge there. Definitely stay away from ice with the progesterone and oil. The Centerra Patch, that heat that it causes can actually help that oil disperse quickly as well as like a heating pad. So ice is the very opposite of what we want in that particular scenario. So just a small little tip there if any of you listening are doing progesterone and oil injections.
Perfect. Thank you for the extra pro tip there. And we definitely appreciate that. That is part of the program, is that all of the expertise and knowledge that you, Kaitlyn, bring to this event, you're able to share with everybody at home. So definitely thank you so much for that. There's sometimes questions we didn't even know we wanted to ask that we learned here tonight. So that was awesome. And with all that being said, that was the last question. So it looks like we're all ready to go and wrapped up. Maybe people are all in a rush to get 2020 over, so they're done with their questions. But thank you so much, Kaitlyn. So I'll toss it back over to you to start wrapping up the program for tonight. Thank you.
Great. Thank you. And thank you everyone for tuning in tonight. I hope that these videos gave you some good hints and tips and confidence that first injection, you're as prepared as you can be. And I promise you, when it's over with, you're going to be so proud of yourself, and you're going to think, what was I thinking? Why was I so nervous? All these tips are made for that. So definitely take them in. Another reminder that all of, the pre-recorded videos and tonight's live session will be posted on the YouTube page, Facebook, and mymandelspharmacy.com/PharmAssist. So 3 different places you can find those. I think that's it for me. I hope everyone has a great holiday. And like Craig says, goodbye 2020. And thank you all for having me.
Thank you so much. I really just want to thank you, Kaitlyn, for all of your time and expertise, not only just tonight, but throughout the entire year of 2020 with being a part of this program. We have really, really had such a great time with you and learning everything that you've had to share with us. And for everyone at home, those great questions that they were able to share, both on Zoom and Facebook Live, not just tonight, but throughout the whole year. It's been a great time. We've had a really, really good time being able to help people kind of put aside some of those fears or nerves or jitters or whatever it might be. And sometimes it's just a look for knowledge, and you want to know a little bit more about what's going on in both your body and your cycle and all of that. So we just thank you so much, everybody, for taking those time out on those Monday nights and coming in and joining us. Just as a reminder, Kaitlyn mentioned all of these full virtual learning experiences, or VLEs as we like to call them, as well as the individual product demonstration videos, are available on demand on our YouTube page, our Facebook page, and as Kaitlyn mentioned, that mymandelspharmacy.com/PharmAssist. Apparently, you can't say things enough these days to make sure you can get a little chance to throw a little marketing out there. So we'll toss that out there. Normally, this is the time where I would say we look forward to seeing you all here again next Monday night at 7 p.m. Eastern Standard for another great program. But actually, there is not going to be a show next week. We're taking the week off for the holiday, and we are returning in the new year of 2021, January 4th. It's finally going to be here. So we're very excited for a new year, new program. All the great things that we've done with PharmAssist are going to carry into 2021. So the one thing I do want to say is that, just like anything else, the best way that people can learn about this program is share, share, share. If you know anybody, if you have a friend, if you have a family member, if you have a colleague, if you have a friend of a friend, anything, let them know about the PharmAssist program. Let them know how much you learned from it and what you benefited from it. And hopefully they'll be able to take something away as well. It's the easiest way for it to pass on, and just pay it forward and let somebody else benefit from the program that you did as well. So with all that being said, I want to wish everyone out there a happy holiday, whatever you celebrate out there. Have a great, great holiday, and we will see you again in the new year. Thank you for joining us tonight. Thank you, Kaitlyn, and have a great night and a great happy new year. See you in 2021.